And then lastly, we've talked about bladder, talked about RCC. Tell me what you're excited to hear about for prostate.
So a few things as far as prostate. In the metastatic castrate-sensitive prostate cancer setting, we will hear from one of my mentors actually about the prognostic significance of the PSA being over zero point 0.2 at 6 to 12 months. And there's a trial called the Triple Switch trial, which has just recently opened, which is looking at those patients. And if they don't have that PSA of under zero point 0.2 at 6 months, we know that those patients have worse outcomes. So should we be adding something? So I'm excited to hear that. We will hear about the quality of life outcomes from ARANOTE. As a reminder, that's darolutamide in metastatic castrate-sensitive prostate cancer. So it added that darolutamide doublet upfront as one of the options. We will hear about the Metacure trial, which is intensified hormonal blockade with radiation in PSMA positive oligometastatic prostate cancer. And then the phase 3 AMPLITUDE, I think, will be one of the biggest things to come out of ASCO as far as prostate cancer data. So this is looking at PARP inhibitors in the castrate-sensitive setting. So this is niraparib with abiraterone for patients with HRR positive mutations. So as of right now, we only have PARP inhibitors approved in the castrate-resistant prostate cancer setting. So we will hear about whether there's a benefit of moving this upfront. And it will be interesting to see if they can tell us details about the specific mutations and the response. We will also hear about an exploratory analysis of the HRR mutations by gene subgroup from TALAPRO-2. That was talazoparib and enzalutamide presented at ASCO GU just earlier this year. And then also in the castrate-sensitive setting, there is a phase 2 trial looking at aggressive variant prostate cancer. So these are patients that have one of three. Sorry, I'm going to start that over. And then finally, in one more trial in castrate-sensitive prostate cancer is a phase 2 trial looking at carboplatin, cabazitaxel, and then immunotherapy, satrilimab, followed by niraparib with or without satrilimab in men with aggressive variant prostate cancer. So we know that those patients don't respond to our traditional algorithm that we use. And then a few other of note as far as castrate-resistant prostate cancer. There is an anti-KLK2 CD3 bispecific. So bispecific antibodies are coming into the prostate cancer realm. A novel B7H3 antibody drug conjugate, and then olaparib with radium versus radium alone in patients with bone metastases.